I was totally muted. Hi, everyone. Nhớ xong, cú trong shit them hono nito kong topic, cú bây giờ Nancy vu trans pronouns cho she her hers or sai thế nu. Cú trong shit them hono bị to she thả thiên chỉ bị tu expert lo to khép bị cho tu ca mo của cho nó thia just other issues that are happening right now with COVID and safety and wellness. This show is going to be in Monglish, so ta chỉ biết cái mong chỉ trong là ta chỉ biết hai English nên chỉ understand. But she be mà record cái này có link to YouTube and nên cái tổ sai later not. So like I said, I work with Freedom Inc. Freedom Inc. giờ luôn cùng hội nhau đó tại Madison, Wisconsin. We have the director of grants and development. So yeah, it's my job to make sure that I tell our members stories so that we access all the resources that we need to do work around survivors and safety. Lúc còn hồi nó nhưng do tôi năng có hiểu nó biết co-executive directors do cái cho Vatia and Adams. Bây giờ họ lựa cho nên họ do Black and Southeast Asian home Khmer folks, Japan women, elder and LGBTQ folks and youth. And one of the things we wanted to do is to begin the 2022 new year with a discussion around COVID, wellness, and safety. And so we have three really amazing experts here to talk with us. So I'm going to introduce them, and we're going to get into a very informal conversation. Yeah, any more question? Actually, like a chat. You know, if you have any questions, go ahead and put it in the chat. We are monitoring questions, and we'll try to answer them as we can. So thank you so much again for joining us tonight. One of our first guests is Dr. Julie Hyong. He is a family medicine physician from Minnesota and a longtime friend of mine. I'm really glad that he's now in the freezing Midwest with me. Thulee about each other in UC Davis in California. Okay. Minnesota. And he's a family physician, primary care provider in Minnesota. And so, Thulee, thank you so much for being on here. Our second guest is Ms. Malia. Ms. Malia, she is a registered nurse working here in Madison. And we're really glad that she's able to join us as well. She's had long days already earlier this week, but she is really crucial in this conversation to call nurse looking on the COVID for home Madison, not the UW. So basically, you know, the resources donate. But the third guest, Miss Ba Tao, Black and Brown Women's Power Coalition, Eau Claire, Wisconsin. The executive director, also has a program called Wisconsin Home Family Strengthening Helpline, which is called 24-hour helpline then all over the country to get support for domestic violence, sexual assault, and other gender-based violence. So we are really glad that the three of you guys can join us. You know, before Kashona, you can talk objective of why we wanted to do this, because the Hobbitu community now, you know, being about there, young vulnerable, right? More adequate healthcare, but people started going out more, you know, because being socially isolated is really hard. So being about that, as people begin to convene again, right, at funerals and family gatherings, people are getting sick and really suffering from COVID. And not only that, but you know, before COVID, you more domestic violence, right? That didn't change it, but it impacted it in different ways. It impacted in the ways where people can't socially isolate from their you know, the people harming them anymore. And there are other kinds of ways that violence is happening too. And so just so many things. And so Freedom Inc. Really wanted to uplift those issues and just give our listeners information about, you know, how they can stay safe and well during this time. So I did ask, you know, when we posted this event, we did ask people to send in questions. And so the way I'm going to do this is I'm just going to ask each of our guests some questions. But, you know, this is really conversational and, you know, it's okay. Whatever Monglish, whatever you want to do. The viewers, any more question, actually, okay. Dr. Hyong, I'll start with you because, I think you have really, you entered your residency during the prime of COVID, in a state that, in a city that, what I know intimately because in Sioux City, Iowa. And not only that, but Tyson, right? And it's a huge meat packing factory. So you were probably seeing the very beginning, COVID patients all the time in the beginning of that. But I'd like to ask you, tell us, what you do and any advice you have for our communities around just, keeping themselves and their families safe right now.
Thulee Hyong là nó cũng hay tu tham mộ family nó chỉ cũng ở lưng cho mình nhỏ giàu thiệt cho lẩu thế này yeah cũng ở lưng cho học clinic đào sư bây giờ họ lưng nó chỉ nên mua cho để cho nên muaตัวต่อ clinic thế cho họ mua lo họ một thế này vậy chứ cũng nên lúc bỏ cho tin này mua có thua lô đồng lô mua ý chế tên là tôi là xã qua sẽ mua đã chỉ này vậy chứ cho họ lưng chế nhau lên đó chế cũng qua tàu khi đó này thì tại sao nó nu tới ý cho COVID chia này cho là hùa Omicron nữa nè nu yên cho COVID thì đã chỉ nu giải mình chỉ cho và tới trái nó nè yên mình bây giờ cũng Malia mình chỉ cho nó để cho vì lý do này thì bảo tàu đi nó nè chế tại sao nó cho và nu tới chia tại sao nó nu kỳ tàu hành tra cho ở nhà và tới trái nó chế tại sao năng thế li พิ่งแต่การมอให้อีผลสิเท่านั้น我比赛的呢，แต่เราเลยชงตาเนาะพวกเขาหรือเนาะตัวอีชงเนาะแต่เรากูกลัวจะโควิดเนาะใจเนาะกลัวตอนนั้นมอช่วงหลังตัวไอ้มดน้องโลมดเขาถอดได้เลยใจกูยังกลัวที่เสียกลัวเตาแต่เราเลยชี้เจ้าหลังสินะอย่าแต่สิรู้สิเนาะเทียรู้สิตาลิออสิตาเนาะซึ่งชาคนเดียวเลยแต่เราเลยเป็นเบาแต่เนี่ยนะอย่าเจcho 我取消，但是呢，女孩呀，我记行呢，记行多叫真呢，这呀，这姑姑啥超市的搞出来么？擦错擦就错不干了呀，擦就错不干了，就错不干了，有的你只么时候嘛哩，别你只讲当只擦就那，但是就错不干了嘛，那我讲你我目的太。ý giờ các món kia này giờ chỉ trong cho COVID nó nữ trừ ở bây giờ rồi nè chỉ cho chua nó mà nữ trong cho ở giờ trừ trái nó hành đua đó là xong nó nữ đi thay chỉ cho trong đâu cho và tập chiến nó đó là cho tin này và nữ cứ sát chua ta là nó chỉ nữ chỉ kỳ đó tụi món nó trong nữ chỉ chua sát hành này giờ nữ chỉ chua sát hành bảo lý cho này và chỉ đó sát chua theo chỉ nữ cứ trong theo bây và cho họ lựa nó chỉ bây những chuyện参考如果那时候冇擦着错了呢，擦着错了可能好帮干贴我就等埋就干嘛呢？你这包呢呀？你这包嘅对肉你只要包子呢，然后那啥时候你摘了做的是那是你就包我到北亚了，对啦。
Yeah, có từ cá nó được phân bổ đó, con tớ I know it's very scientific and it goes into like what is a virus and how does that change, but I think what is important is how does a vaccination protect us against the COVID-19 and Omicron, and then what does it mean to get booster?
Yeah, so let me justกูจะบอก他昨天那么古啥别个是到上面就那要接到你到那到上接那特里去穿菜他能去ว่า用里你有到上接有特里有么菜出的了有特里啥菜那要接好我你包嘛你别就好包呢你好包那么你么啥的就干嘛那么你那路是那要接inu onu tên nó sẽ về nữ tư và ở bên tiền là nó nữ tư là anh gì trên ở bên tiền là gì nên sai trong này tin này trong này you quan nên là you mua you chấm nhỏ tức sợ you mình gì để cho cho you mình nói cho you chấm nhỏ lo rồi you lo you chấm nhỏ mua mót sợ you nè cho cá món nó trong ý lên đó là cho cá món mà nữ khỏa hay này à nữ khỏa hay gì 一安努阿边努在那时间你都换子或一点子而且你包很很的那就你包到一容易呢，就一点钱呢就到你莫得呀诶，走上诶你好地菜到就出诶，然后被菜那多你其中你就好了呢，就要点莫得呀诶出息钱诶，你好我毛记到点很容易多呢就那要找诶我换子，那就你这里包装了呢。给这里出息的呀，我有的比如说只帮干被读看就忙了朋友好点能但冇呢就你莫考考 chance 的你要保呢是呀到内呢就好你这保证你保呢好我有插 booster 那么用嚟俾咗 vaccine 咧，就俾啲差別講啦，但是你有個差一公子就 booster 好啦係 booster 那麼你要就講錯幫緊啦但是用嚟個差就錯穩定啦，就個路就我到依個錯啦地睇就感冒啦那樣就但是你你冇就錯呢就我錯咗去路這呢你再多睇呢樣你再多就得到個路就住我輕薄啲住我當薄啲頭要你學差咗錯幫緊啦頭穩定就啦睇你有個要大家差多就得了差工資呢就你我到一路這大家我就錯我地睇呢到時候大家到時候多啲呢就你睇你摸你睇你摸 booster 呢就可能摸叫了晒就錯vaccine 俾啲差大仔呢就嚟bỏ係要差到你我講問題呢咯做你知路去做路去做巴士就錯地睇呢你到時候呢就嚟睇個差工資可能大家嘢多睇你地睇到要到傾就只要咗vaccine 但係呢你睇問題說就俾人一直差呢樣就 vaccine 呢俾人一直差到你廿毛咯仲你頭咁有冇可能要做到差人的是嘛？你因摸就不是，你那一样就但他的呀让那到了一个差不是，他大家差多了那因摸点啥学就那他空就那多了呀bỏ hay địa chỉ hình đại rồi cho và you khó và cái đi thay cho món là nên đau rõ nữa cái thế you chỉ tao sai rồi cái booster cái này rồi là sao mà you ta can boost you khó và immunity or cho you cho cái đi thay cho cái món nó còn người ta can gì được
You know, Dr. Hyong, I hear a lot that ít chọn nên là lần txhaj mu or vaccination, thì lần txhaj what call booster because li lo ba mà only it's just only they want to come back and they're trying to hello again and that's what they
yeah
think. So can
yeah
you talk about that? That you know,
right
con trai nàyยัง real hả mà? But can you
yeah
explain it, you know, more
yep
about
so nếu cứ chỉ cho cái lý là thế nào nếu chỉ cho hay thì cho vaccine mà nếu我哋係咗 vaccine 啦，你都冇年代啦，比如比如冇年代到只就到就下就送到那樣，即係你只摸咗我但是那麼你只摸佢都感冒誒，我都要摸你做到好咗 vaccine 咧，你做拖一個妹妹用你話。用你話依個妹妹呢，都感冒呢，大豆咯，等等那樣，即係落做到好好 vaccine 咧，你冇做到好，嗰啲仔薄。一路在包含的就一路在啥还得你莫感冒了那就你特里我一路在特里我叫错了嘛老的太可能就你老多考你把妹了是呢就头就一路在我叫错那到老大了是不老多可能就頭都感冒的點解嘅咯嗰路就一路在都包那樣，可能都包多了。就你特里冇多就感冒呢是晒的是呢就感冒呢火知道。就有啲你全部摸呢，還有個啥的，個知道保，一路就知道保多，那就你淨係出試後咯，我就穿了啲睇就感冒呢，頭要幾多都摸得啲呢，就你試後呢，你睇就路時候我要摸係就有路時候但是呢，貼我用嚟我就啲呢，就路時候頭要摸係呢，有就其他短巴有多就感冒呢，但是我知道就穿了早嘅。同那啲頭先你摸係向貼，嘅啲到啲你話有啲個話啲睇嗰幾次出咗嗰啲睇出到個摸嚟也摸定到我都有試曬呢，嘅路線嗰啲有路線河要摸係向有啲要摸等咪攞嘅要路線河呢， chỉ giờ thì có đứa sai câu chua và vaccine nó vấn đề lỡ ấy lúc chỉ tấm ba tàu cho chua ấyตัวจะการมอนวันได้เลยนะเจถอดตัวการมอนที่เตียนการเราเขาเจอยู่ตื้อบ้าเตานะย่อเจอยู่เจตื้อบ้าเตาเจหนึ่งตัวการมอนเลยเจ๋งดัวเจหนึ่งจีมั่วชิเหหัวเจอยู่ที่ลิชิมั่วมั่วนั่นแหละเจขอวัคซีนว่าเขาเลยมาจงแล้วสินะเจหนึ่งจีตัวการมอนที่เตียมีอีกข้อไม่เอก็ว่าตัวอยู่รู้เจ recognize ตัวให้เตียพอน้อยย่อจะการมอนเดินนอลีนั่นแหละเจหนึ่งกุศลให้เตียจะการมอนเดินลีเจหนึ่งขอว่ายี่ห้อกุศลเปียร์เราใช้ได้มาย่อเขาว่าในมุชาวัคซีนเองนี่หนอจงเลยชาตายจงเลยอยู่มอนะย่อจงเลยอยู่อีเทียที่นั่งจงเลยว่าอยู่กูต่อเขาเลยกูอีเจเลยไม่เจจงเลยอยู่มอมไปนั่นนะเขาในเจนึกชี้ให้เดียอยู่ต่อการมอเทียเขาเขาในมาย่อนึกปอดcho là mới cho được hồ vaccine nữa là trên xã thìอยู่ต่อตัวมอnữa làนะเจก็รู้เจเขาว่าก็รู้เจกูเนี่ยเจอยู่รู้เจxã thìอยู่ต่อการมอเจรู้เจว่าก่อนกูซะนะแต่เขาchoว่าอยู่nó liên quan chỉ choอยู่nóเขาเองก็รู้เจป้าตัวเจ้าการมอนั่นน่ะอย่าเจJohn เองที่จะทิ้งให้นึกมั่วจะ side effect เขาจะช่วยดูอยู่เขา John อยู่วันบ่ายนั้นที่Malia แต่ว่าอีกนู้นแต่สิ่งอย่างอีกด้านนู้นแต่สิ่งเจนึก John เลยต้องเขาถอยรู้เจใช้เขานึกชิมว่าจะในที่เที่ยงเขาเจอยู่ที่ว่าเจเลยดักการ John เลยนะนึกชิจะตัวมอที่เที่ยงนั่นแหละ
Yeah, Dr. Chong for explaining that because I think you can think like good txhaj case only go high more, you know, but like you said, it should just be no on no super yeah.
Yeah.
You know, she lo yang txhaj that she lo she understand that la txhaj la ya la mo yon cho nên cái giống này nhau ít khó cho mình they can still have that COVID, right?
Yeah.
Can you talk about that even if you're vaccinated, you know, you should still, you know, if you're in small spaces, you should still mask up and you know, be safe around elders and vulnerable.
Yeah, họ tới mình mà nói rằng là trong lý tụ tàu chết là nó sẽ mà cái sai trong lý tụ tàu chết là và hiện tại có cái sai số tàu là sai số tàu là nữ hay chừng mót tàu này đó họ và lý của hai tụ mót là mà nữ chết làอย่างนึงพอtàu lý ở chỗ nó sẽ chạy bây giờ chỉ bảo hay thì nữ bảo trong lý trả đấy chạy tại nó chạy nữ trong lý nữ bảo hành lý nữ bảo hành thế nữ bảo sai trong lý lười giả mót từ mua tới giả mót trong lý flu đấy flu chạy nữ trong nó flu chạy ít xong nó chạy thế tới cho chết chạy tiến hành hành mót đua nó chạy tới rồi tụ mót ít sẽ tiến hành sao thì tới nữ trong lý là thiệt nó chạy yêu yên chỉ bảo là chạy có tới sai số ta là ít sẽ tiến hành chỉnh tàu kỳ tàu thiệt đó chỉ nữ trong khó hay thì giờ thì có sai số ta là nó chạy trong lý nữ cũng bắt tàu gì thế phong cảnh nhiều mình chỉ chỉ cho tàu kỳ tàu hành thiệt giờ thì có kỳ tàu là dùng dùng chỉ cho sát hành nên là chỉ những yếu chủ tàu sai hiệu được khen mà thiên chân trong hay thì nữ chỉ cho mó khẩu vị nó sẽ theo nữ chỉ mua lười giảm mó ấy những sự mua nó nhỏ tại vì nó flu cũng đã có chủตัวthiệt khẩu thọ là nữ chỉ mua thiệt nó chỉ giờ thì vàอยู่สากลสมอที่อยู่สากลชอบกี่ดอลลาร์ตัวเองก็อยู่จงก็จะก็จึงลงแมสที่ว่าเขาใช้ย้อนเรื่อยๆ是的ที่คลิป到你可以去做么那样但是我平常呢是的我领导是的ลงแมส是的去做ย้อนที่呢结果没得呀么去做休息对吗没得呀么要带ไปปอ休息ปอให้呢你去做休息ที่จะ都有这这里包还得叫我是的我呢弄 math 这几撮鸟 OK 呢你把到呢你把到了呀种里我比赛的种里叫我摸着把每样摸种里或 strap 呢strap 呢像呢你几撮摸很暴力撮切像那样我比赛还比赛呢种里真的过能过怎么有摸着那些叫老摸着那么因摸着很力但是像呢trong đó cũng có ít trong đó cũng được tao ít case này ạ, được tao ít case này được có cho vấn đề tàn thế này, thật tu sửa này ạ, đó họ em cũng sao để đó họ sẽ là long mass sẽ là chỉ cho nhau ok nó chỉ nên cũng chỉ cho kỳ cho mọi để giảm mọi nó thế này.
Yeah, thank you for explaining that because I think you know, people have to understand that yes, you want your fears, you know, you're in China with txhaj, no one likes to get a shot. But though you mark you know, like có hai có vaccination, có you cho mỏ hay hay na, có you pierce cái ta, có And I think that's really important. And I think it's important to hear from your perspective that, sometimes based out there, or through vaccination because we do still see a lot of sick people, but you're actually saying the evidence, right? The evidence is you see less sick people than you have seen before if they have been vaccinated. And I think that's very important evidence.
Right. And I also want to point out that, you yên bỏ tới giờ và tin là mỗi giờ you bỏ cho nhớ gì you thấy cho you nó sẽ nè但是你们啥的叫出vaccine呢你能通plan的对呢那呀因差中很里呢但是呢这波的爬波的蓝都你能都差出大呢呀这叫我的肉你么对都more side effect you nó hay từ more nó sẽ đó chỉ cho chống nữa chỉ more này就种你起码你么啥点然后通感度呢是被出度点都差大了呀差大天天因整天都差了呀这以前点嘛人就猜就可能喏係就度那麼呢度那麼呢但是咗麼就可以就講出嚟差了麼就可以多啲呢就出度是咗我哋麼呢嘅咗我哋麼的日的明我麼一日allergy usually 背後的我 anaphylactic shock 呢or anaphylaxis mà nữ đây đầu tiên nữ chạy đây không đây我到女皮要用嘢呢呀我哋也之後女嘅女毛頭有啲女皮多嘅女皮落嘅我知道8咯180咯blood pressure 崩咯啲那呀嘅女毛係但是可能嘛ตอนนี้มั่วแต่อยากรู้เนาะทนนี่มันชัดช่วยจะเลยที่เลยก็อยู่ยอดตอนนี้ก็ชิ้นนาทีมันตอนนี้ไปจนนาทีเต้นใช้อยู่รองเชฟผมมันตั้งใหม่ตัวเขาจอที่ไหนยอดแต่อยู่มั่วจะside effect เนาะเจนี่มั่วรู้สึกเหตุนะจะจงเจนี่มั่วเลยก็ชิ้นนาทีเต้นแล้วเขาจะมั่วล้อเลยเจ usually ยอดแต่นี่มั่วเจนี่ตัวมั่วเท่าเลยไปจนนาทีchỉชวนมั่วเท่าคนละนะเจเลยที่เลยใช้อยู่ก็ว่าป้อใช้อยู่รองก็สมมั่วเลยมันจะอยู่ไม่ใช่นะ
Thank you so much. I want to go talk to Malia, a little bit because, it's been about 2 years, right, Malia? And like Thulee, you were in school. You were finishing up nursing school when the pandemic hit, and then you entered into the workforce at the height of the pandemic. Really, can you talk more about what you've seen and what you're doing now, and then I'll ask you a few more questions.
Sure. So I think transitioning into nursing when I first started, it was, COVID was still around, but the Delta variant was around. So we were seeing a lot more sick people. I would say a lot of those people were largely unvaccinated at that point. And now with this recent surge of the Omicron, we don't have people as symptomatic as they were before, but it's taking a large toll on prolonged hospitalizations, a burden on the healthcare staff because we're short-staffed, and that kind of rolls into how the burden has fallen on long-term care facilities when these people are here for so long that they have to go elsewhere. And I mean, at this point, I would say getting vaccinated is the best way to stay out of the hospital.
Yeah, Malia, I didn't even think about this because I know my mom got COVID and then she was hospitalized, but she was able to come home, within a few days to rest up, probably because they didn't have room for her.
Right.
You and I actually talked about, about what hospitalization actually looks like for a COVID patient. And I thought that was really illuminating. I think, can you talk more about what that experience does look like for the COVID patient, but also for their families? I don't think people realize how, how intense the process is.
Yeah, I think COVID has taken a very large effect to the psychosocial aspect of hospitals. People who test positive for COVID, they're not allowed to have any family members to support them while they're in the hospital, which can be really detrimental to their mental well-being. You're literally sitting in a room, if you are a COVID patient, in your bedroom, and literally your only interaction is generally with healthcare staff who aren't always there because they have other people to see. And there was this one instance, I had a patient, he was literally saying how this experience would mess him up from his whole life because we couldn't allow visitors. I think the hospital has been a little bit more lax, but even just the thought of sitting in the same room, these 4 walls, for 2 weeks straight with only hospital staff to support you really hits people mentally.
Malia, do you get a lot of questions from your friends and family about COVID? And what are some of those questions that you're hearing, or some of those concerns that you've been hearing as a nurse? I'm sure you get a lot of questions.
I think the biggest question is what kind of people we see, like whether they're vaccinated and unvaccinated. I think with the Delta, a lot of people who were in the hospital were unvaccinated people because the symptoms were so much more significant. Now with the Omicron, it's kind of, I think people who are symptomatic with COVID are unvaccinated people, and then people who have come in for something and test incidentally COVID positive end up on our floor. But it does prolong the hospitalization stay.
Yeah, and I can't even imagine like a 2-week stay where you're pretty much, like you said, confined to like a room. and you even said that a lot of times like the doctors and nurses are so busy, and also for your own safety, right? Because you don't want to be exposed. Like a lot of times the patient is just communicating with you guys through like a tablet or something, and right. Not even be with a live care provider. So I and then as you and I were talking, it reminded me of like we already don't have adequate health care. Mm-hmm. And like what does that mean to have a hospital bill for like a 2-week stay or like long-term care? And I know none of us are experts on that piece of it, like the billing piece, but what that could do for people after the fact too.
I don't directly see the financial aspects of healthcare because I do a lot of bedside nursing, but I'm sure hospitalizations are longer, which result in a higher bill for people. We have patients who are fine for the most part, but the doctors decide not to send them home on oxygen. So they're literally there until we can wean them off completely. And they have to pass what's called a 6-minute walking test for that to happen. For my personal experience, we don't really send people home on oxygen, especially if they're normally like baseline healthy, like you or I.
Thanks for that, explaining that experience, Malia. I think we'll have some more questions later from some of our viewers, but I wanted to also talk to Ba about, mm-hmm. At this time, Ba, like, yes, people are getting COVID and or they're taking care of people who have COVID, right? And so they're not able to work. They're not able to then afford, if they're not working, they're not getting paid, then they're not able to afford like their bills. And there's so many impacts from COVID that I know Freedom Inc. we see all the time. Like last year, I think we gave out, close to almost, gosh, I mean, it was a lot. It was at least like $900,000 worth of housing funds from the CARES funding. And then our own budget, we were helping people pay for housing, on a weekly basis, just because people were losing their jobs. And then not only that, but I think the intersection that Freedom Inc. wanted to uplift as an agency that supports survivors is like, how is COVID impacting survivors? Like, in your work with the Helpline, like what are the kind of calls that you're getting? And let's talk about support for people who are facing these challenges.
Yes, definitely. Thank you, Nancy. So at the Helpline, we're definitely seeing a lot of calls for just, basic needs stuff, right? No longer are people just calling to like get information about where they can, find a safe place to go. They're calling for housing. They're calling for food. They're even calling for like COVID information. And so it's great that like people community now, the 報道係啲the Hmong Family Assistance Helpline, how more幾把抽到 with other things besides what we typically do. And so those are some of the calls that we have been receiving over the last the last year and a half, 2 years with COVID.
And in the beginning, I know this is such like negative, a negative statement, but even before COVID, even before the pandemic, right? Like domestic violence and all those forms of violence has already existed. I think I'd like to hear, just how you think COVID has impacted survivorship even more in a different way, and how, I think people, what people can hear from you about, resources from them, and I guess just like a way for them to know how to take care of themselves and their wellness.
Mm-hmm. Yeah, so being about the the governor have the safe at home order. That it's not safe for everyone, right? Being at home is not the safest place for them. So being involved from the get-go, right? And so, we were able to like pivot some of our resources to like be able to respond to survivors who may not be able to like obey, right? So we started the text line. So now people can text the Hmong Family Strengthening Helpline instead of calling us. That way, if they don't need get back, or they can text us instead of calling, and so it could be more discreet, right? Those kind of things. We know that during COVID, like abusers will use like COVID as a tactic to isolate victims further, right? Some of the things that they would do will be like, oh, I won't let you go get tested, or there's COVID, so you can't go get help. They would try to like further isolate you from like your friends and families. They would tell you, oh, because of COVID, just to try to isolate you further. So then additionally, like we know that abuse will escalate during COVID, right? Because the partner or new abuser new because of COVID, like cool and so services are like more limited. They can't just go like down to see the family, right? Because we don't know who is in quarantine or who may be infected with COVID. And so they use those kind of tactics to like further isolate your victims, survivors who are victims who are going through domestic violence, right? And some of the resources that the helpline can provide is be a peer support for you, right? And help you connect to local resources. We know that a lot of bigger programs in Wisconsin looks a bit different than it was pre-COVID, right? They may have limited hours, they may have limited staffing, and that kind of thing. But the helpline can help you seek out those resources and can help you refer you to the ones that are in operating, or help you like connect to like different resources, that can like help you. Additionally, one of the things that victims can do at this time is to really safety plan, right? That's the most important thing is to have a safety plan. So okay. So some of those tips that we give to is that okay. Or trust okay. Lúc xưa học COVID nó từ nên我陪这个来用包的有么 COVID 啊，and so they just do what in the they're gonna like try to use that, right, to like further isolate you, like I was saying earlier. And so don't be afraid to ask for help, and don't be afraid to like tell your friends and your family what's going on, right? The other thing too is that you should always have your phone, right? Make sure that if possible that you have a phone that you can access all the time. And one of the tips that we've been telling our folks too is that you can actually you can set your SOS notification on your sidebar, and so that's the tips that we're giving out to everyone, because even if you have base like on Android and on iPhone, you can set the setting, and so 頭個嘢個可 sidebar the volume sidebar like 3 or 4 times. It will like contact your emergency contact, right? 個嚟包我哋嚟跟你巴啦呀，聽 it will like automatically record anything that's going on, and so like more something to like verify that something happened, and those contacts can be like you có clear cho hạt tiệt có more timing cái you có hỗ trợ cái là thì bảo like hạt tiệt là ba cái cái này. It could be like the local shelter, it could be the police department, right? Whichever emergency contact that you choose to like put into that setting. And additionally, just you both you know how children can because we know like you have to change you to think you put more into zona you say you lúc vậy change họ tư họ chơi ở trong tờ này okay, and so always know your exit points, right? And so chỉ có nhớ họ có chơi là chỉ có mỗi họ chơi chia nè cho có từ khu and open cho con na always say họ chơi tờ họ tư, okay, and always like mentally make a note of like if something that's happened, like this is how I'm gonna get out, right? So then you never stuck in a situation where có một sự họ chơi có chỉ tao sát sát nữa na thằng một tấm mình cái họ bảo thì cái một họ tư thì đi họ chơi nữa thì đi họ cái nhiều thay lại con này
Yeah, but I think those are such good practical tips, right? Because people talk about it in theory like, oh, you need help, we can help you, but those are actually really practical tips. And I think what we're seeing at Fruity Meek is we're also seeing violence happen in a different way, like because they are isolated because of COVID. They're struggling more because people are not able to work. There's more stressors, right? If your partner was the breadwinner or you were the breadwinner, you no longer can, or your kids are at home for virtual school and you have to stay home and watch them. There's so many stressors. And so I think that people don't realize that, it just impacts people in such different ways. And one of the things we're noticing too is like with youth, right? Now that they were on virtual school for about 1.5 years, and more kids were online and being, I wouldn't say cyberbullying, but there was a lot of like internet trafficking, a lot of people going on the internet and chatting, because that's how people want to socialize, right? So we are wanting to make sure our youth understand, safety. They're not taking pictures of themselves and posting it online, right? And then we also know that even if people aren't going out and engaging in an abusive international marriage, they're still able to send money abroad or talk on text and Facebook and everything. And so there was a lot of financial exploitation too, right? There's a lot of like financial abuse in the home where the money is being misused. And so I think I just want to say those things because kusaka pek y'all listeners about it. Not sao tan thao cho tới mình nó na, thì có đi bảo thế, nếu mua nên đi học bị kéo nên hụt bé mà chế to peer advocate, chế cho resources. Don't nên đi bé hay bị lu helpline ở nhà học Wisconsin, but I think we get calls from everywhere, and we we try to help connect you to any resources anywhere. And then one of the questions that came up is like, with children who are experiencing or witnessing violence in the home, like how can they get help? Like, what is your advice for them?
Yeah, my advice is to always, you have the internet to see na you bought the, you see more cases how you don't know to talk with your kids, right? Because but they pick up on so much, right? They do. And so like if things are like if things in the house is stressful and whatnot, like have a conversation with your kids, just let them know that regardless of like what's happening in the house, that you still love them as a parent and that you will always be there for them, right? So right? Because with kids being home and with being homeschool and virtual school and working from home, all of the stressors added to that. And we may think that our kids again but they do. They know more than we give them credit for, right? I will also like you have to victim and my partner is the aggressor. I will safety plan with my kids, right? And so go call safety plan with gone on and so because you want to make sure that not gonna go to like what they should do, right? You have to like so the one of the things that we always tell people too is that you should have a code word, right? You code to ask for help, right, in an emergency. But you should also have one for your kids. So 頭個係嗰個路呢，就個叫咩嘢啦？嗱，啲包佢哋哦，今年呢個股冇好不利，哦，今年呢個股欠夠後俾佢敲俾他做呢樣。And so have a place that your children can go to that they can feel safe, whether that be a room that they can lock themselves in or going across the street to a neighbor, right? You have to what that means, and I can go and get help from my mom for us, right? Or for for Bay. So always involve the kids and that you have to listen like bao tá like bao chi xiong là bao tá là, okay? Involve them in that because you want to also make sure that that they also are safe. And whatever
Yeah, thank you. And I think talking about youth, maybe Malia or Julie, you guys can answer this question. If minors want to get a vaccine and their parents don't want them to, like, what is the process for that? Do you guys have the answer for that?
Actually have not. Yeah, I've actually not come into that situation specifically. No, so I'm not really sure. I'm not really sure what the laws are about that. I know that there are, and Malia, if you know, please, jump in. It's a very specific situation, but I know that there are certain situations where minors can actually get treatment without the parents' consent. So I'm not sure for sure whether this is one of those situations. Yeah, I don't want to say because I don't know for sure.
Yeah, I can't really speak to that aspect too, unfortunately.
Yeah, I think that's an important question, and we'll look into it. I think part of it is probably just so whoever asked that question, I'll try to follow up with.
Yeah, let's go.
And then there was another question around how do we respond to elders who tell us they don't want to go to the hospital if they're having complications because they are scared that they go they're just they're gonna get sick and die. And I know I'm saying this in English, but I'm sure if I spoke in Hmong, it would be much more compelling, the way our elders speak. Yeah, I guess any of you, like, what would you say to the elders who are saying that?
So I wanna make one comment about that because that idea, has been around for a long time, right? It's not just with COVID. I think the big thing here is the difference between cause and association, right? So你不要你莫晒的，你不要就他们考你特里多一直点他们晒呢呀，的话的哦，你毛钱你冇钱你特里那么我哩我那钱多了，那但是考真正的点的读点呢，到你都冇行呢呀，你都冇拉拉的，你都冇行嘅，就我冇拉拉的就冇行呢，贴俾就好嘛，俾有的同毛咪嘢俾就冇同毛嚟睇。giờ cho tôi mua hàng tôi sẽ rồi nó chỉ phải mà cho một thế ít mà chừng to cái tôi này tôi sẽ rồi tôi tôi sẽ chỉ mà đi cho một cái thằng này chỉ để cho một cái ít là khó tàu ít là khó tàu này rồi hỏi chỉ thì hay để tới giờ là tôi đó người thì lý rồi đó là giờ người tôi mua rồi người tôi theo người tôi xài nữa nè chỉ yêu bỏ đi nữa chỉ yêu chỉ lý xã hay để giờ thì khó là tôi người thì lý rồi所以đó họ nó mà cú cho họ lừa nó chỉ cú yên bỏ đuổi theo chỉ cho hai kia cho không phải nó sẽ ta chỉ lừa giảm món này rồi chỉ cho mình nhỏ giàu lô cho tin hơn lâu lô tên nó là tôi tao họ lừa tao cũng training tên nó này rồi thế họ lừa tao lâu chỉ xong là chỉ cú yên bỏ cho và tin hay tao bự tao họ mà này thì cú hai đứa này thì cho tin hay tôi mà đi chơi á cho chỉ cho là khó tao nữa trong chỉ là cả một chế thế này rồi thế chỉ khó ở nó mà giờ thì you hay biết rằng you chỉ bỏ cho họ lừa nó chỉ you chọn nó cho tới giờ và nữ bị phèn xí này giờ thì you chọn nó cho đi ý ở tu lô cho tin thằng nửa mùa ấy tua xí nè dù chỉ bỏ thế dù chỉ nó cho chống ấy mùa chỉ một tấm ảnh này giờ ít khó cũng mỗi ít khó và bị sao mà rồi đi và hậu bên hông nửa mỗi ít khó và idea cho mình giờ mỗi mỗi ấy nửa từ bỏ này giờ sau cho một đợt tham mỏ đó là cho họ dù cho một đợt tham mỏ như tham mỏ mỗi đại để chỉ nửa tua nữa giờ còn nó một cái đó nên thì nửa chỉ mua này giờ nửa chỉ mua cho họ ít xe cho tàu bỏ nữa mà nếu muốn nó tàu giả bỏ ít xe ít mua tới giả bỏ thì mình nhớ tàu là nếu chỉ mua tới mình lo mua tới giả thì nếu cho tới mình lo là nếu theo chủ cho bỏ nữa nữa thì cho我去bỏ nữa mà我哋估係頭啲都處得有狀態嘅，唔係你將冇嘢得就都用的都實行那樣嘅，就靠我哋家啦你去用了，好係啦，碰到大啲啦，可能大啲啦嘅以前嘅頭都用你實行嘅，將冇嘢你就 blood pressure 可能咪又好，你保持咗好耐嘅，你去保。你將 blood pressure 都係輕那樣，又都再俾過 blood pressure，有 blood pressure等你係輕啦，就要注意要出到乜啲多，有啲個乜啲多嘅。你叫 blood pressure nó cây thâu thì你要多晒的是的，即考了大的就要了大個，你叫 blood pressure nó dây，你睇你全部就得明的，同 blood pressure cây thâu nữa，nó即我得明到lúc就我可能即冇 heart attack 嘅冇理由得明貼，那呀即你把咩你就把可能是係咯，你我可能到頭部我可能到好冇到你 blood pressure 呢就苗誒多背到好冇到就總呢得肉下就 percent 得你就俾大的。即古人知道麼？一度民話古巴看來你多很多呢，即話你麼一個學得明呢？又一學即要俾麼出菜天然菜即可能嘛，因此啲你對你對要到麼？要菜的原菜呢？又即人菜即只叫木頭啊，你全麼每次要都到咁樣呢，都是沙嚟呢？又即要嘛你叫木即來看牛貼話。一學就可能，一學就我估係要做攞咗咗為你冇得明攞攞先咧，即係有啲你睇到啲你睇好之後咧，就你攞咗就啲你招募咪有全部得明啦，至落學大你大家攞嚟，就有就做係咧，你學到就你攞啦
Yeah, no, Dr. Chung, thanks for explaining that because I think legal high it's a cultural concept, right? To COVID, you know, and I think we recognize that yung chai yung more valid him you know yung chai yung more valid to copy more generational trauma này bây giờ cái bây giờ bảo thủ cái nhưng chỉ muốn ba bé you bây giờ để cho you by color là trai you máu tu hỏi nè so we recognize that you more valid concerns but it có hai more science right cause science cause bởi vì cái tiết thì do là mười họ mẫu gọi là more sick or tí do là more hang là mà bài but also what I'm hearing you say is that you more thôi you có bị more cái sự nào you to buy right lấy thay khó tao thằng đó theo là you take prevent khó more lo chấp lại nè so có tiền cho nên luôn rồi nó nè cú sa validate này cho concern này cho fear cú bảo để bé chấm không bé nhưng lợi dụng qua page cho bé để gì đi cho chúng hay nè thôi you bị more cái you chỉ mua hay cái này là thay khó tao thằng đó kia là thay thiệt là để sẽ bỏ more khó lo nè
Yeah, sorry, Nancy. I just wanted to add that one thing that you bought you to you cho mình nhỏ lâu chuyện này nãy giờ nên một cô mói thì nên lâu rồi thằng một việc chạy nên lâu rồi thế giờ thì nên một lù nên support cho thì nên lâu rồi nè để có you thấy tao rồi hay thì tụi mình nhỏ mói rồi bây giờ thì nên cho tụi mình nhỏ mua tập clinic nãy giờ nên cho tôi sai cụ tụi mình nhỏ nên mua gì tấm ảnh nữa thì nên nông hay thì OK cụ tụi mình nhỏ mói thì nó tới rồi có bỏ nên rồi nên chỉ mói lo đã chỉ đó là giờ thì một chế有主筛选谁能让家要还得让你家庭里冇落呢个有到那样 so when you bring somebody in and if they're not having a big issue at that moment but find out what are the concerning signs, the things that you need to watch out for, because then you'll know. So part of it is just educating yourself, because I think one of the problems is if you don't know those things to watch out for, those concerning things, then when those happen, you miss it. This is another idea when it comes to healthcare in our community that is a problem, is that sometimes we people in our community fear things that are not very concerning, and then sometimes they don't fear things that are very concerning, because you don't know the difference. And this is nobody's fault. It's just that you just don't know. So if you take somebody into the clinic, or you take somebody to see the care providers, you ask them, okay, so what are the things that I really need to watch out for? And so that way that when it is very scary, or some of those signs show up, then that it's an emergency. You need to get them to the hospital, or you need to call the ambulance to get them there much sooner. So I have seen personally in my own personal life, I've seen some relatives and community members that thầu là mò và thầu là mò lo là chỉ bảo giờ là chỉ txhaj đấy giờ là chỉ mua giờ thầu là mua giờ nữa từ li là nó họ mất giờ giờ nữ chỉ trong txhaj là nữ chân txhaj tí nữ chân txhaj giờ tí nữ họ chỉ cho từ này là mua khó ít giao thiệt là giờ nữ họ mua xe cho nữ của tôi hay là sát thiệt là giờ so yeah.
Yeah, and I think on this question of elders too, during COVID, big elders gate, they're very neglected, they're very isolated, right? We all want to protect them. That means baby. So there is a lot of elders who are not only are they not wanting to make a big deal of anything, right? Because they don't want to concern their families, but then because they're not doing that, right? They're also facing a lot of elder abuse. And do you have any advice for how we can better recognize that and ways that we can engage with our elders, that we can support them?
Yes, thank you, Nancy. So I think, what I said earlier, applies to your elders, but we have to also understand that your elders are, like your and their barriers to share banana is tenfold right? Because the chipao, big elder the chipao the chipao, they won't get back in your how lose so you tell them get on your get it out the jola how more high like your thinning chap, more high like your menu. Then they'll say that they don't know the information themselves to make that decision for them. Thế bây giờ lo ba lấy những lo đi của điện là lấy những rely on cái mình to make that decision, right? And so lấy những hai cái tu rồi cái cái tí tua hay xin and so I think bây giờ lo như thế bây giờ bảo hết that's how our parents are going to be, and how bây giờ law is going to seek help, that we should know better. Như thế là sẽ hay tu sự bé là sẽ tu hay cho bé hay thế là mua cái chỉ cho na that we really bỏ được cái chỉ cho as it is, and cho hay thế có Washington Day là also law đi có cái nhau to you none of that is going to be helpful to any victim that's going through domestic violence and sexual assault, right? And so always you have to see power and I can always uplift and always that's her deal her get it on her.
Yeah, and I know that we're almost towards the end, but Malia, I want to actually come full circle back to you, because one of the things you actually see are patients who, yes, they have the physical the physical illness, but the mental wellness, the psychosocial wellness is so key. And I want to come back around to you is what advice or tips are you giving to your patients, when they tell you, I'm scared now, I feel like I almost died, I feel like I was never going to see my family again. What are you telling people when they're in your care about that, and I guess to kind of help ease them in that moment?
It's kind of hard, but I think that the best thing that we have to offer so far is just connecting through video chat. Sometimes these patients can't see their family for 15 days, and then the current protocol is that they're allowed one visitor, but until that day passes, those 15 days pass, we can't really do anything about it. So just connecting with loved ones, whether it's just seeing them on video, is a big thing. And I don't know, just taking our precautions so that we can prevent further transmission of COVID. Just letting someone know that you're sick and just staying at home when you are, instead of attending all these events because you feel like you have to. Limiting your contact, wearing masks, hand washing frequently, all the things that the public has been telling you to do.
Thank you, Malia. You know, I know that Honana Beta this is a really ambitious panel, but I felt like it was so important to bring all of you guys together to just create a cohesive picture about this issue in our community, right? It impacts so many other parts of your life, in the hospital and in your home and your family and your social life and your mental wellness. And so typical Nancy is going to say, I already have like 10 more ideas for 10 more panels. And, you know, I like Dr. Hyong, I want to talk about like preventative care. Like I want to talk about recognizing symptoms that are concerning, you know, before it gets worse. Like Malia, you know, I want to talk about mental wellness and psychosocial care, and like, you know, and even like, you know, the impacts of like, health access to healthcare. What happens when you have been hospitalized so long? Like, what does that do to you? And you know, like I want to talk more about, you know, resources for survivors. Actually, walking people through like safety planning. Like, what is a safe exit? You know, what is a conversation with your kid? What does that actually look like, right? You know, so what, you know, for giving me more work to do, you know, for our community. You know, I think, you know, we all love our elders, our youth, our LGBTQ folks, and we want to make sure that we continue to provide research for them. And, you know, I want to thank all of you guys so much for taking time out of all your very, very busy schedules, sleepless schedules, to come and talk to us. But in these 3 last minutes, you know, maybe do each one of you just want to say one last thing to our community about, you know, wellness and entering the 2022 in the safest and most healthy way. You know, Pa, why don't I start with you, and then you'll go from there.
Yeah, I just want to share with our community that, you know, that you're not alone, right? Chứ có một cái chỉ cho cái thời gian chỉ là, you know, mua bé chỉ là cái giống như họ Wisconsin nó ba nè, rồi cái họ tư là bé ba tàu nè, so, you know, cho tôi đây, như thế có một cái cho nhẹ cái chỉ cho hữu tua, okay? Biết từ phone number những khi đừng có block xong, okay? And then for the younger folks that, you know, about internet or whatnot, you can go right on our website and see all of the resources in your region that can help you, okay? All of the culturally specific resources that the Helpline works with is listed on our website, and we will get the link dropped in there. But, you know, you can go on there, you know, get connected to the advocate. We have them named out. And so, you know, Thank you, Nancy.
Thanks, Pa. Thulee?
Yeah, so I think in my area, I know that there's a part of the fear and the issues that we have around vaccinations and what's going on now is that there's a lot of information out there. There's a lot of fears and there's a lot of misinformation. So, you know, if you guys hear something or you hear some recommendations or some information, I want you to just think about it, you know, and really try to figure out where that information is coming from. Is it coming from reputable sources? Is it just somebody's opinion? And what's the data that is backing that up, right? Did somebody get that information from, you know, some research that has been done, or a bunch of information that's been collected, or is it just somebody's opinion, or is it something that you know, somebody has only gotten from a few people, a few cases that they've seen? So I think that will really help you to make the decision about what is useful information, what is real information, and what is opinion. Okay. The other thing is, I quickly looked up the whole youth and vaccination question earlier, and you know, just like a lot of other laws, I think it's all very state dependent. There are some fewer states that allow minors to make some general health decisions for themselves, including vaccinations. From one source I saw, it's like 16 states do that, and then for the rest of them, they don't really do that. You have to get parental consent, unless you are in certain special circumstances, like an emancipated minor if you are pregnant, or if you're not, if you meet some of those criteria where you're not directly under your parents' care anymore, then you can make some of those decisions on your own. So.
All right. Thank you for that update. And Malia, why don't we end off with you? Any last statement to our community?
Yeah, lastly, it's just do your part. Healthcare is being burdened so hard by COVID that we can't even take care of the patients who regularly need our care.
All right. Thank you, guys. I really appreciate your time. Thank you, viewers, for coming on and listening. And please, share this far and wide with everyone, with everyone, because I learned so many new things here. So thank you again. Freedom Inc. really appreciates all of you. And we're ambitious. We're hoping to do some of these every month, a new topic every month. So please follow us on our Facebook page for more updates. All right. Thank you.
Thank you.
Good job.